Well, I want to thank you and thank Pam Fallbeck for allowing us to be here today to talk about the implications of healthcare and the ObamaCare that was passed a couple of weeks ago and the implications for senior citizens. I'm actually here today because I think that we now have documentation from the Obama administration himself, from the Department of Health and Human Services, that confirms exactly what we've been talking about the last couple of weeks, and exactly what 75% of Hoosiers have been talking about, and exactly what people in the home health care industry have been talking about, doctors, physicians, and more importantly, what senior citizens in this state and this nation have been talking about, which is this. A report that comes out dated April 22nd from the Department of Health and Human Services, which confirms what we've been talking about, and we've been accused by people like Nancy Pelosi of saying this is political rhetoric and we're making these things up and this is a fear factor, but not according to this report. According to this report, senior citizens in the state of Indiana and around the country will be paying for Obamacare. This budget will be balanced on the back of retired, limited income Hoosiers. And I think it's absolutely wrong. And I just wanted to point out today a couple of things that came out in this report that are glaring miscalculations that were obviously made by this administration and obviously by Joe Donnelly when he voted for this, and then some of the absolute falsehoods that have been reported by not only our congressmen but Pelosi and Obama at the federal level. You know, the things that were reported were that this was the best thing that could happen to senior citizens because it was going to open up health care, but not according to this report. This report says that these health expenditures contained in this Obamacare bill are now going to increase by a total of $311 billion during the calendar years of 2010 to 2019. So much for the concept of this being budget deficit neutral. This is not deficit neutral. It's paid for by senior citizens. It also says that the original $500 billion cut in Medicare is now up to, according to the actuaries, $575 billion will be cut for Medicare. Including in that will be the cutting of the Advantage program. And what this report says is that senior citizens who are going to lose the Advantage Care program are going to basically get put over and moved over, not by their own choice, but a mandate, into a regular Medicare program. That regular Medicare program will then cost them the cost of an expensive supplement that they'll have to bear the cost, additional copays, prescription drugs costing more, and access to care limited, because the report also says that 15% of hospitals and other institutional providers will be in the red within the next 5 or 6 years. 15% of the facilities in the Michiana area means absolute restriction of access from senior citizens who may not be able to drive, who may not be able to get to a place. It also means places like we're in today, which is a home health care provider, as their services and as their repayment from Medicare is going to continue to be cut. It's going to put strain on them as well. It says in the 2nd District alone, home health care agencies like we're standing in today that will be paid less than the cost of Medicare will grow from 28% today to 51% by 2017. So we're not only restricting the access to senior citizens care, now we're restricting, because they're not going to be paid, agencies that will go in and actually take care of people at home. It also says, which we talked about, and our congressman said was not true, it says that they're estimating that the actions of the Obamacare bill will collectively reduce the number of people with employer-sponsored health care coverage by 14 million, and 2 million Americans that currently have employer-provided health care coverage will be dumped into Medicaid. And it says, all in all, the actuaries predict, and the actuaries are in this report right here, predict that millions of senior citizens will lose their Medicare plan because massive cuts to the program will result in about 50% of seniors no longer being in a Medicare program. I'm telling you, this is wrong. This is exactly what we talked about weeks ago. This is why 75% of America said we don't want this. Go back to the table, start over, do something that people can afford, and do something that won't cut out our greatest generation, our most vulnerable people, our parents and my grandparents. We just went through this with my father a couple of years ago, where my dad died of terminal colon cancer at home. He died after 3.5 years of being on chemotherapy. He had home health services at home, and then he was taken care of by hospice. I cannot believe that we're standing here in 2010 having a conversation now about the confirmation of what we knew to be true, that our senior citizens have been sold out, our parents' generation, my grandparents' generation, that built this country, that worked their entire lives, are being sold out by their very government and the elected officials that they put in charge of defending them. And I'm telling you, ladies and gentlemen, this is the most crucial thing I've ever seen come down the pike to confirm what we knew our worst fears to be true. That seniors are going to lose coverage here, and it's not right, and we absolutely have got to fight to defund the appropriation of this bill before this thing kicks in January. So I'm promising members of the 2nd District today, constituents, And anybody that is in the ear range of these newscasts, that I absolutely will file a defender of this bill in January, so that the appropriation itself is taken away before not only the taxation kicks in, but before our seniors, my parents, and your grandparents lose their medical coverage. Interestingly enough, there was a Rasmussen poll delivered yesterday that said this: 58% of likely voters favor repeal of this Obamacare. 60% say it'll increase the deficit. 57% says it'll increase healthcare costs. 51% said expect the quality of care to decline, and 52% say the healthcare law overall is bad for the country. And this report summarizes the findings of Obamacare by saying this: Americans should be prepared for doctor and hospital shortages under this new law. This is wrong, and we have time to stop it. We have 6 months to stop this, and we can stop it by changing the members up in Congress. And I tell you right now that we have got to defund the appropriation. We have got to take this thing on headstrong and stand up and say that we are going to be the defenders of the senior citizens of this country. And I for sure promise you I will. And I'd love to take questions.
Jackie, but
yes.
About the same time, if this is to kick in January, you don't change the members of Congress until January, so how can you really rescind it with the current leadership in place?
You know what? We have to change the Congress, Don, and we can change this, because the taxation in the state of Indiana kicks in about the middle of next year with the increase of Medicaid. And what I believe this report says is that the 30% projected increase in Medicaid in the state of Indiana, which is what our economists are predicting, basically what you can surmise is this: that this Obamacare and the cuts in Medicare that are in this report, basically you can make the connection to say all we're doing is shifting tax money. We're taking it away from the senior citizens and giving it to welfare. We're taking it away from Medicare and we're giving it to Medicaid. So the people that have worked their entire lives in this country are now going to not only lose their benefits, they're going to watch them go to Medicaid, which in the state of Indiana is going to be a 30% increase to the tune of, to every working Hoosier, have to pay $2.5 billion in this state. Those taxes kick in the middle of next year. If we defund this, and we actually have pressure on Barack Obama not to veto a defunder, then we can actually save senior citizens health care and save the state of Indiana workers in our own state from being in bankruptcy next year.
Go ahead. No, go ahead.
Go ahead, Chuck.
Sure.
I'm a hospice volunteer,
Yep.
and I've heard that the hospice funding will be cut under Medicare. Is there any figures in there that say how much or what the extent of hospice cuts will be?
I don't have hospice figures here. I know hospice will be cut because they're a home health care provider as well. And if you take a home health care agency just like this one, who already 28%, they're receiving already 28% below funding for Medicare, they'll be receiving up to 51% less by 2017. Hospice is looking at the same thing. Hospice is looking at horrific cuts, multiple millions of dollars in the state of Indiana. And the atrocity of all this is this: the government, which is actually in place to take care of vulnerable people in the midst of the peak of our aging baby boomer population, the generation that built the infrastructure and made this nation great, is literally being hung out to dry right now. And the shift in this state is going to go right to Medicaid. These Medicare cuts are going to leave our people unprotected. Their options are going to be limited. Their access will be limited because of what the report says about the closing of hospitals and institutions. And even a place like this that provides home health care will be in jeopardy because of the cuts. And yet, Medicaid welfare is going to boom in this country like we've never seen it, and that is absolutely wrong. Do you have a question, Ian? Okay. Questions? Thanks. Appreciate it.
Thank you.
All right.
Thank you.
Thanks.
Great job.